story begins back in 1972 when my brother was injured while in the service. We began the facility in 1980 and had a staff of 10, had 3 patients, 2 of whom had no funding, and one of those was my brother. Today, over 30 years later, we now understand the incredible importance of neurologic rehab. The Los Angeles facility began in late 1999 and functioned for about 10 years as primarily a day treatment facility. In the last couple of years, we added a residential or inpatient component to the program. And that program serves between 30 and 40 individuals at any point in time.
So some things you can expect if your family member is here at CNS is a very intensive program that involves physical therapy, occupational therapy, speech therapy, and counseling. So every morning before the patients get there, we have the opportunity to discuss the patients, what their goals are, and how we can work together for the best outcome. There's a thorough assessment that's completed, and from there we begin building this individualized treatment plan. The therapeutic day is structured with 3 hours in the morning of therapy and 3 hours in the afternoon. There's a normal break for lunch. The therapies are very intensive. They're 50 minutes a piece, and working with each discipline. For example, in PT, you might see a yoga group or a Tai Chi group, or you might be working individually with a therapist on balance and coordination. One of the cornerstones of what we do is our cognitive rehab program. Each program is tailored to the abilities or the needs of each patient. So for some, they'll be working on memory, attention and concentration, divided attention, problem solving, speed of processing. Nursing, along with providing the medical oversight for our patients, they're also providing classes here on, for example, medication management, educating them on what their medications are for, how that they work with the pharmacy and getting their medications, and so that they are able to take on those responsibilities when they leave CNS.
Usually our patients come here after a day of therapy at the clinic, and we still continue the rehab at the house, more in normal activities of daily living. And then we'll start homework assignments that the therapist usually will assign to a patient to increase their rehab going a little faster. After cooking, they get to have dinner together, and then they'll follow their nighttime routine, getting ready to go to bed. What assistance do they need to go to bed? How can we increase their independence so the family get an easier life once they're back home? Initially, we will assist them with all of the part of the medication, and they'll move farther in the rehab. Then we'll give them more responsibility, so then we can transition them back home.
Another important part of the program is reintegrating into the community. So we're getting people out of the clinic, whether that be to manage simple transactions at the grocery store or be able to find what they need, scanning and looking for items, pathfinding. Every treatment plan is different. And when there is good communication between the families, the patients, and our clinical staff, that's where great things happen.
Knowing that we've changed an individual's life for the better, from some of their darkest moments to what will again be a life of some hope, of some meaning, a return to previous function, a return to family, a preservation of family, the ability to hope once again, the ability to live happily once again, and to know the difference between happiness and sadness, all matters. That's what gets us up in the morning.